All right, we'll go ahead and get started. Today's August 10th. This is the Makah EOC public briefing. We'll go ahead and start with Dr. Cope's report.
All right, good morning. Let me pull up my slides real quick. Is it showing?
It still says it's starting.
Okay. Perfect. Should we up now?
Yep, good to go.
Okay. All right. Well, we just got another active case, and so I worked really quickly to get these slides updated. So they are updated as of 11/25. So this latest new case is an adult who is in quarantine. They have a known exposure, and that adds to make us a total of 17 active cases at this time. Case and contact tracing is already underway for this new case, but until that is done, we have 27 households in official quarantine. Yesterday, we had 73 individuals as well, so that might be added to. It just depends on what we come up with when we do the case and contact tracing. Sometimes when we have folks who are already in quarantine, there aren't any other households, but in this case, I anticipate there will be actually probably at least one other household in quarantine. Also, we learned yesterday that we have one confirmed Delta variant. This is a case that was originally diagnosed in King County in late July. So I anticipate it'll be at least another week or two before we get more info on the rest of our cases. But what we generally do is assume that once Delta is in a community that it is accounts for most cases. And I'll talk a little bit more about Delta on a later slide. So I put together a little spreadsheet of how things are spreading in Neah Bay and what is causing most of the spread. So clearly in this one, we have a cluster right here, and that is all attributed to one person who traveled. And you can see I just wrote coworker if the exposure happened through work, or social if it's a family or a friend, and then household if it's someone who lives in the household. So we are seeing pretty regular spread with household members. So if one person has it and then they're quarantined with the rest of their household, it does seem that the rest of the household is getting it. We have one person who traveled and participated in a large gathering and haven't seen any spread so far from that. One person who traveled and we have seen their household member also get it, but that household member also traveled. Same with here, wherever I have T, that person also traveled with the original case. This slide just shows what it will look like next week if even just the household members all test positive. So including the case that we just got, if their household members test positive next week, we can anticipate seeing 11 new cases. I did include unvaccinated individuals and vaccinated individuals for this. Hopefully the vaccine will prevent spread to a few of these, but I think just looking on this slide, certainly a majority of those in red are not vaccinated. So that's kind of just a prediction for what might happen next week or what we can anticipate or for the remainder of this week. Clallam County is certainly high risk. Their percent positive has remained above 8 for quite some time. The majority of their cases are unvaccinated. 8% of those are vaccinated. They have 3 current hospitalizations and unfortunately had 1 new fatality at the end of last week. Their rate per 100,000 in the last 14 days has been 282, which is quite high. Low risk is 25, moderate risk is 75, and high risk is anything over 75. So that is certainly very, very high risk. And as you can see, they're well on their way to being as high as they were during our Clallam County's spike last fall. And same with Washington State. So they're rapidly going up, and this is as of August 5th, so last week, but I know this data has gone up since then. So variants of concern, as of the date that this report was done, which we get weekly, there were still only 15 cases in Column County. As I mentioned, we found out yesterday that one of our cases tested positive or confirmed for that variant. So I'm sure this number will be updated and will be increased next week by next week's report. The state's lab is several weeks behind on testing for these genomic sequencing, but based on what we know about the Delta variant, it most likely accounts for nearly all new cases in Washington state at this point. These are variants of interest. So this Delta variant, so what we do know is that it is at least 2 times as infectious and more transmissible. So what that means is that some of the near misses that we had seen maybe earlier on in the pandemic, where there was a close contact, but that person ended up not getting it, that's not going to happen anymore. It's pretty clear that the close contacts are getting the virus, regardless of whether or not they're vaccinated. I will say there's been a few cases that household members remarkably have not gotten it, but for the most part, we are still seeing vaccinated household members get the virus. So again, with the Delta variant, we're just not going to see as much of those near misses. The close contacts are, especially the household contacts, are most likely going to contract the virus. Let me just move to the next slide. So then the question is the vaccine still effective? And this graph was actually brought up by one of our providers who, or it just demonstrates how for every 102,000 vaccinated, so this is the current statistic, there are only 100 symptomatic breakthrough infections. So a breakthrough is somebody who's fully vaccinated. So here's a pool of everyone who's vaccinated. Only this amount have symptoms who have it, and then only 1 death. And not that certainly that death matters, but we're trying to prevent as many, or prevent any single deaths. So anyways, I thought this was a good graph to show how effective the vaccine is. So the situation would be much worse, certainly if we didn't have such a high vaccine rate. We have all of the vaccines available, and we are desperately trying to get more people vaccinated. So we have a vaccine clinic going on today from 9 to 4. We have vaccines anytime we are open, and we are happy to meet patients where they're at if they have a time that works best for them. Certainly, we just really need individuals to get vaccinated. And I'm sorry I wasn't able to get the most recent updated vaccine rate. As of last Monday, it was 70.4% of individuals, or of our residents in Nia Bay, are fully vaccinated. I know that's gone up because we've had a number of new first doses and a number of second doses in the last week. And then people who had gotten the second dose 2 weeks ago becoming technically fully vaccinated. So I know that number's gone up. I know we even yesterday had, I think, around 14 single or first time doses. So I know we're getting there, but I don't have that percentage right now. Just a quick update on the public health protocols. So Nia Bay is in phase 1 of the Makah COVID-19 public health protocols. This is using section 6 of the current health order 0521, which says that the council can choose to be in a temporary emergency phase 1. And that is what is happening. It's being extended because we have ongoing new cases and kind of an ongoing case and contact tracing effort at this point. What phase 1 means is that all individuals must stay home except for essential and safe activities. These activities are listed in the Makah COVID-19 public health protocols, which are posted, I think they're physically posted in the usual places, and they're also posted on the stick.org website. It's on the homepage. If you just look up Makah COVID-19 public health protocols at www.stihc.org. The essential and safe activities are listed in the definitions. I believe it's on page 3 or 4. And there are several things that are considered essential and safe, like going for a walk or a run, exercising alone or with your household group members, etc. And then the question we're getting a lot is on traveling. So traveling protocols are also in those Makah COVID-19 public health protocols. And these don't change with the phases. So, and we designed that because whatever is going on in Nia Bay, we need to be able to, the council needs to be able to respond with policies that apply specifically to our behavior here. And then if things are not going well elsewhere, we still need to be able to respond to that because of individuals traveling where there might be more risk. So in this instance, if a Nia Bay resident, according to number 2, which I want to draw all of your attention to, if a Nia Bay resident travels and has close contact with anyone outside of their household group, which means being within 6 feet for 15 minutes total without a barrier, such as a window or face coverings or face masks on both individuals, they must go into a preventive quarantine upon returning to the reservation. A preventive quarantine is basically the same thing as phase 1, which means no close contacts. I pulled this definition out from the Makah COVID-19 public health protocols as well. So really, truly, somebody returning from travel needs to do the same thing that we're all being asked to do, which is no close contacts outside of our household group. And the reason it's just going to phase 1, if somebody has had exposure, like a known exposure to somebody with COVID, that's different. If somebody has known exposure, the person that they're with calls them and says, hey, I was diagnosed with COVID. Do you want to come in? And then they would need to contact the health officer, and we will talk to them about case and contact tracing, and that would be official quarantine, which is different than preventive quarantine. All right, my last slide I went over last week is just an image of what is low risk versus what is high risk. Certainly any indoor parties or larger gatherings, air travel, etc. I'm going to go ahead and end there, but I also have Dr. Eastburn in my office. I know you didn't get to hear most of that, but do you have anything that you want to add to our briefing?
No, another positive.
Oh, I think I covered that.
Okay, just a little bit ago.
Yep. Okay, we're on.
That patient is symptomatic and is on medications and has been since Saturday.
Okay, hold on. This is the public EOC briefing. Okay. All right. Yep. So
they're covered.
Yep. All right. Sounds good. All right. That's it for me. If anyone has any questions, I'd be happy to answer.
Dr. Cope, it looks like there's one in the chat box if you want to address that one.
Yeah, I have heard rumor about the CDC only counting breakthrough cases that are hospitalized. And then there's more. Yeah, so, and I didn't report out on any vaccine breakthrough cases. So I understand that that is true, and that is something that the CDC is doing, but we are reporting on all of our cases, and I haven't, it didn't include in this presentation our vaccine breakthrough cases. So at this time we have 2, and we're certainly counting those who have not been hospitalized. Okay.
All right, well, thank you, Dr. Cope. Appreciate the update and all the hard work. Please pass it on to the state staff and all the medical personnel that you deal with. Thank you very much.
Thank you.
All right, we'll move on to Patty. Patty, you got an organization update for us?
Good morning, everybody. Just for information purposes, all the small business applications have been received and sorted. And unfortunately, they were going to go to the council for review and approval, and then the shutdown happened. So that's postponed a little bit. Our finance department is functioning with 1 employee at any given time in the office. And then the rents for housing units have been postponed until Friday, August 20th, which is when the tribe reopens again. That's it.
All right, Patty, thank you. Appreciate the update. And please pass on to your staff and personnel. We appreciate everything they're doing. As far as the Makah EOC, I just want to remind everybody we're in phase 1 right now. So keep that in mind while traveling. Masks are mandated in public places and all tribal buildings upon opening. Be safe when traveling for essential needs. Take this proper safety precautions and measures to ensure that safety. And then I have a plea that everybody who goes through the checkpoint, please cooperate with the staff up there. They have a rough job. It is taxing on them, and they are doing a very important service to the community. So I would appreciate everybody passing on that cooperation to that staff up there. The men and women up there are doing a great job. Please continue to check the stick.org website. The public briefing will be posted at a later time. We also update the travel information. Since we have went into shelter in place to phase 2 and then back to phase 1, we have seen a decrease in traffic. So I want to thank everybody for doing their part on the essential travel. It was good to see those numbers. They were actually tabulated last night, and I believe we'll be able to put that up on the stick website as well. Please continue to wear your mask, vaccinated or not. And there was one other question that popped up. And as of right now, we're not going to address any Makah Days information. We're not there to address that as of yet, because we'll have to consult with the EOC staff and then make a recommendation to the Makah Tribal Council and also the Makah Days Committee. So thank you for that question. I believe that's all I got. Everybody, please stay safe. Continue to practice those safety measures that are in place. I want to thank everybody for their participation and keep it up while we're going through this phase of response. Thank you to the Makah EOC for all the work. Thank you to the stick staff and EOC for all their hard work. I also wanted to thank the Makah Tribal Council for their support and continued response in this effort. So you guys, please stay safe and have a great week, and we'll see you next week. So thank you.
Chief Bruner?